Thank you. Like Dr. Dean Finnegan said, my name is Haley Miller, and I'm in the Community Health Promotion MPH program. And today I'm going to be talking about my work with Fairview on a project called Live Well, Lead Well. So how many in this room, from some point to another, experience work-related stress? Probably most of us. As 8 in 10 Americans say that they are stressed in their work. 25% of Americans report their job as being the #1 stressor in their life. Stress can lead to a lot of negative health impacts, and annually $300 billion is spent on healthcare and missed work days due to workplace stress, among other factors. So to me, this is concerning, and it's what has sparked some of my interest in this area of public health. So now if you consider that working adults spend 1/3 of their day, 5 days a week generally, in the workplace, this along with long hours, high work demands, poor support, change in roles, and job security, all have the potential to lead to some negative health impacts. Some of the ones that we see specifically in the workplace include low employee morale, poor retention, decreased productivity, absenteeism, and again, high healthcare costs. But in the midst of these negative health impacts, the workplace has become an important place to intervene on some of these issues. Implementation of worksite wellness programs has the potential to impact long-term lifestyle choices of employees. I have been collaborating with the employee well-being team at Fairview, working to create an online wellness toolkit. This toolkit is aimed at leaders within the organization, as they are really in a critical spot to influence employee well-being and serve as role models in their organization. So the project is called Live Well, Lead Well, and the goal of this is to provide resources for engaging employees in well-being, in addition to helping promote health as a business priority. Now, we often think of well-being encompassing physical activity, nutrition primarily. However, it extends far beyond that. The current wellness model at Fairview encompasses these 6 core dimensions of well-being. It's adapted from Tom Rath and Jim Harder's book titled The 5 Essential Elements of Well-Being. And the resources in this toolkit target each of these core areas in some way or another. The resources range from discussion guides that spark conversation about well-being to ideas for engaging in team wellness challenges. We are currently in the process of revising and evaluating the toolkit, but our hope is that within the next month or two, this resource will be available to all employees at Fairview. So you might ask, why target workplaces? Well, organizations that have adapted some of these similar worksite wellness programs or other health initiatives have seen substantial improvements in the health outcomes of their employees, and has also led to reductions in chronic disease. And I think work sites are really starting to catch on and recognize that these programs can benefit not only individual employees, but also the overall success of the organization. And some of the health outcomes that we see include improved productivity, greater employee engagement, and again, reductions in chronic disease. And I think all of us here in our own workplaces can really have a stake in reaping these benefits. So as I've mentioned, the goal with this toolkit is really to provide easy-to-use resources to leaders, specifically at Fairview and hopefully other organizations, that can allow them to help promote a culture of well-being within the organization. And as this picture illustrates, the next step is hopefully creating a healthier future for those in the workforce. And I'm really excited to continue doing this work and help in making that change. Thank you.